Hey there, welcome back to How to Medicate. Welcome to this new video on what is a depression and how can you treat it. This video is part of a video series on mental health problems, and you can check out the playlist I made in the description after watching this video, of course. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this video and of this entire channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get started. So as promised, I will start this video by explaining what exactly a depression is. Google describes a depression as feelings of severe despondency and dejection. However, you and me would probably describe it as feelings of persistent sadness. A depression is a serious mood disorder that can be diagnosed by a doctor or psychiatrist. This is done based on criteria from a diagnostic manual called the DSM-5. In order to diagnose a depression, someone needs to have 5 or more of the symptoms associated with it in the diagnostic manual during the same 2-week period. Of these symptoms, at least one should be a depressed mood most of the day or loss of interest or pleasure. Other possible symptoms might be significant weight loss or weight gain, a slowing down of thought and a reduction of physical movement, fatigue or loss of energy, feelings of wordlessness or excessive guilt, a diminished ability to think or concentrate, and recurrent thoughts of death. In addition, in order to receive the diagnosis of depression, these symptoms need to cause a significant distress or impairment in your personal, social, and occupational functioning. And these symptoms can't result from substance abuse or another medical condition. They need to be caused by the depression itself. Then a depression can also co-occur with other medical conditions: anxiety, substance abuse, ADHD, PTSS, personality disorders, functional somatic syndrome, and/or cardiovascular disease. These co-occurring conditions can have a huge impact on the depression itself. They can increase the risk of a relapse, can lead to disability, can lead to higher numbers of suicide attempts, and it can delay recovery. Therefore, it is important that your doctor is well aware of your complete medical picture, so he can take these other medical conditions into account when he's making your treatment plan. Which brings us to the question, how is a depression caused? And unfortunately, there is no clear answer yet. However, it is thought to be caused by 3 different factors. Biological ones like genetic predisposition, psychological factors like negative life experiences such as childhood trauma, and social factors like your socio-economic status. Now, unfortunately, depressions are quite common. About 2% of the general population is dealing with a depression right now. However, during your entire life, there's an 8 to 18% chance you will develop a depression at one point. Although this hugely varies per country. In Japan, people have about a 7% lifetime chance to develop a depression. However, on the other end, in France, it's about a 21% chance. Which finally brings us to the possible treatment options. And here I want to start with the basics. It might be obvious, but it's important that you take good care of yourself, from a physical standpoint, but also from a mental point of view. This means change your clothes at least a few times a week, shower regularly, maintain a tidy home and workspace, and keep a structured sleeping schedule. Try to wake up and go to sleep at fixed times, aim for 7 to 9 hours of sleep per night, and try to avoid sleeping during the day. In addition, it might be helpful to plan and fill your days. This gives purpose and helps you with structuring them. When making your schedule, make sure to do some activities outside your house. Sometimes a small walk can be enough. Next up, follow a healthy diet. Make sure to eat enough vegetables and vitamins and drink about 1.5 to 2 liters of water a day. And lastly, try to stay in touch with your loved ones, your friends, family, colleagues. Maintaining social contacts could contribute positively to your mental health. You could do this physically by meeting up, but calling them or WhatsApping them will go a long way. If these last tips are insufficient or if your symptoms worsen, then it would be time for the next step. Visit your doctor for a medical examination. When you're dealing with mild symptoms, your doctor might suggest to wait for a short period to see if your symptoms improve by themselves. Your doctor will probably monitor you closely. However, if your symptoms do not improve or even worsen, then your doctor might start therapy. Your doctor might suggest several different types of talking therapies and counseling. One of the most used therapies is cognitive behavioral therapy. This therapy aims to help you understand your behavior and thought in order to change the way you behave and feel. It also helps you to analyze events from your past, which might have an impact on the present. And lastly, it aims to help you challenge negative thoughts and feelings to slowly overcome them. When following cognitive behavioral therapy, you will have sessions once every 1 to 2 weeks, which last for 30 to 60 minutes. Other forms of psychotherapy could also be helpful, like interpersonal therapy, psychodynamic psychotherapy, and/or counseling. For more information, you could discuss each of them with your own doctor. Now, besides psychotherapy, your doctor might also prescribe you antidepressants. These might help for most patients, but do not help for everybody. There are many different antidepressants, and sometimes you need to try several or a combination of several before you will find the one that works for you, and this can be challenging. In this video, I'm only trying to give you a broad overview of the different groups of antidepressants. If you're looking for a complete in-depth video on each of them, you can find them in the playlist in the description. Now, when prescribing antidepressants, doctors will most often start with SSRIs, selective serotonin reuptake inhibitors. This is done based on their side effects, interactions with other drugs, experience with this drug, the price, and other risks. Examples are citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. As mentioned, I made videos on each and every one of these drugs, and you can find them in the description. A close second are TCAs, tricyclic antidepressants. These have only a little more side effects than the SSRIs. Examples are amitriptyline, clomipramine, and nortriptyline. And there are other groups of antidepressants, but these are only used in specialistic psychiatric care, so these go too in-depth for this video. Which brings us to the last treatment option we will discuss in this video, brain stimulation therapies, which contains electroconvulsive therapy. In this form of therapy, an electric current is passed through the brain to impact its functioning. This has an effect on your neurotransmitters, which could relieve symptoms of depression. Electroconvulsive therapy, however, is an invasive form of treatment which is only used in severe depression where no other treatment option has worked. The last treatment option I want to discuss is transcranial magnetic stimulation, TMS. In this treatment, a coil is placed against the scalp of a patient, which sends brief magnetic pulses to stimulate nerve cells in the brain. This can help to regulate mood and depression. As closing words, I want to address each and every one of you who is currently in a crisis, or each and every one of you that knows someone who is currently in a crisis. Most countries around the world have a national suicide prevention lifeline. You can find the appropriate number by Googling it. Please call this number or call your doctor or psychiatrist for help. Which brings us to the end of this video. I hope it was helpful, and I hope you know more now about depressions, because educated people make healthier decisions, which is the whole point of this channel. If you did enjoy the video, please leave a like, which would help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you could help me with that. Click that subscribe button. For those of you that can't get enough, I also made an Instagram account at How to Medicate. I'm posting there a few times a week, so you can find new updates there as well. And before you go, I want to thank all my sponsors on Patreon. Thank you, Sebastian, who's an investor tier supporter, and thank all of you for watching. I will see you next week on Mondays and Fridays with new videos. Bye bye.